Hey everybody, happy Global CE Day. I've got a special friend here today, a physician, WHO former head of health technology management and clinical engineering, health technologies, hey, you grew up in Russia, my friend Andrei, and
Yes, I
but
did.
you live in Geneva, but you've got experience all over that part of the world. So tell us a little bit about what you've been doing lately.
So you mean what I've been doing lately in Russia or just in general?
Anywhere.
Yeah, I'm after I retired from WHO 10 years ago, I work as a consultant in various hospital-related issues, and also work for a couple of companies for regulatory affairs on medical devices. So I'm still quite busy.
Well, I know COVID has probably cut down on those air miles that you used to get a lot of.
Yes, yes, yes. It's mainly at home.
But the home office, huh?
Yes.
And I know your wife's a pediatrician, and she's so wonderful to take care of a lot of children there in Geneva. So Andrei, I mean, yeah, Russia and the former Commonwealth of Independent States, 10, 15 countries we're talking about here, but a lot of their efforts in health technology management have been siloed. What are some of your thoughts?
Yeah. So actually, clinical engineering and technology management, in its international meaning, is not well known in Russia, or maybe it is known but not kind of applied. And health technology management is not viewed as a logical sequence of integrated events. Various parts of health technology management cycle are separated and being dealt with different actors separately. And also most of the materials, available materials under health technology management, they are mainly about maintenance and repair.
Yeah.
Yeah. So that's, for me, that's the main problem, that there is still no one who is kind of, trying to put it under common umbrella, all these activities.
Andrei, how's that worked out? I mean, this is an impossible question for you, but how has that worked out in the time of COVID? How have those countries dealt with their, COVID critical equipment needs?
This I have a difficulty in responding to this. Maybe I can explore this a little bit further and provide you with information maybe a bit later. I can contact some friends in Russia.
Sure. Well, I'd appreciate that because we want to be able to help.
Questions.
Certainly COVID has been one of those issues that brought clinical engineering and HTM to the fore in many countries and, into the purview of the Minister of Health. Another thing, though, is digital health. I mean, how is Russia and the former Commonwealth states, how are they integrating digital health? Because we know clinical engineers can help there, too. What do you think?
Yeah, so digital health is now actually being developed very rapidly in Russia, and telemedicine applications, e-health applications, they are more and more widely used, but particularly in such a big country like Russia with many remote areas.
Sure.
So this now all kind of teleconsultations in which leading centers in Moscow, St. Petersburg are involved, leading professors providing consultations to their colleagues in faraway locations.
Yep. So maybe that's another dialogue that we can continue over the coming months, because CED has the privilege of working in several countries now and helping, like organizations like HIMSS, the big health IT company organization, 85,000 members around the world. CED is actually partnering with HIMSS in India, in Ministry of Health India and beyond, So, I mean, maybe we can help with the digital health initiatives.
Yeah.
And today,
And
there was a conversation with Saudi Arabia about that. Go ahead.
yeah, and there are now there are very many startups. There is such a uh, kind of techno park, or the location where it's kind of the Russian Silicon Valley, kind of,
Yeah.
which was established uh, by Medvedev, when Medvedev was for a short period of time president of Russia.
Yeah.
So the guy who was between, I mean, so there was Putin, then there was Medvedev for 4 years, and then Putin again.
Well, we're trying to keep you out of political trouble here, Andrei,
Yeah,
so we won't go there too far. But
so, so Medvedev established this facility not far from Moscow, which is supposed to be the hub for all kind of innovations and research, etc. And there are so many startups. It's called Skolkovo, and there are now lots of startups there, and many of them are involved with digital health.
Well, Andrei, 30 years ago, you challenged me in lots of ways, and now I'm challenging you to to help us get in the middle of some of those things. So we look forward to what might come.
Yeah, you see, I was planning to do quite in-depth research on all these issues, but then with all this
COVID
problems,
has slowed all that down. Yeah.
Yeah, so it's people.
It's a challenge.
So the first
it's a challenge.
thing that everybody are too busy.
Yeah.
With solving all the problems, with
well, we're working hard, to help bring telehealth solutions many places, so maybe we can help there.
And I'm not able to travel to Moscow, which I was planning to do for several months, and I was planning to travel there at the end of this month, and just half an hour ago canceled my tickets because all flights are canceled.
Yeah.
So it's.
Well, anyway, we're going to bring this to a close, but
yeah. So I just
it's
wanted
good to invade your home here today.
I just wanted to add a couple of things that there are several issues which are quite well developed in Russia. The first is, in recent years, Russia developed very good regulatory mechanisms. They are very sophisticated, and all issues related to registration of medical devices are taken very, very seriously. Good. That's one thing. Then biomedical engineering education is rather strong.
Good.
Both under and postgraduate. So biomedical engineers are there, but they work mainly in research and in industry, which is there, or they work for the foreign manufacturers, for their representative offices in Russia.
Sure.
So then health technology assessment is being developed in recent years rather actively, but it still has a long way to go to become a part of decision making.
Well, Andrei, we're going to wrap this up, but you and I are going to help change all that. So we'll give ourselves a couple years, but we're going to change all that.
Okay, we'll try.
Thank you for your time today. We'll talk to you later. Bye.
Thanks, Tom. Bye-bye. Bye.